Vitamin C, also known as ascorbic acid, is one of the most important nutrients for the human body, and yet many people do not fully understand its role, its benefits, or the precautions they should take before using it as a supplement. In this video we will take a deep dive into everything you must know before taking vitamin C supplements, from its history to its functions in the body, the correct dosage, the possible side effects, the myths surrounding it, and how to make the best choices for your health. Vitamin C is a water-soluble vitamin, which means the body does not store it and it must be consumed regularly either through food or supplements. Since it dissolves in water and excess amounts are usually excreted through urine, people often assume that it is completely safe in very high doses, but that is not the full picture, and this is where understanding becomes important. Vitamin C has been studied for decades, and its role in immunity, skin health, collagen production, antioxidant defense, and even heart health has been well established. If we look back into history, sailors used to develop a disease called scurvy, which was a result of vitamin C deficiency. They suffered from bleeding gums, weakness, joint pain, and slow wound healing. Once citrus fruits such as lemons and oranges were introduced into their diets, the symptoms disappeared. This discovery was one of the earliest pieces of evidence that vitamin C plays a vital role in human health. Today, deficiency is rare in many parts of the world, but poor diets, smoking, certain medical conditions, or increased stress can all lower vitamin C levels, making supplementation a potential need for some people. When we talk about benefits, the list is long. Vitamin C contributes significantly to immune function. It enhances the activity of white blood cells, helps fight off infections, and shortens the duration of common colds in some cases. It is also essential for collagen production, a protein that forms the structure of skin, tendons, cartilage, and bones. This means vitamin C supports skin health, prevents premature aging, and helps wounds heal faster. As a powerful antioxidant, vitamin C fights free radicals, unstable molecules that can damage cells, cause inflammation, and contribute to chronic diseases such as cancer and heart disease. It also helps the body absorb iron from plant-based sources, reducing the risk of anemia. Another major benefit is heart protection. Some research suggests vitamin C may lower blood pressure, improve blood vessel function, and reduce the risk of cardiovascular disease. It is also linked with better brain health, since it supports the production of neurotransmitters and helps protect brain cells from oxidative stress. But while these benefits sound very promising, it is not always as simple as taking a pill. Before taking a vitamin C supplement, it is important to know how much you really need. The recommended daily intake for adult men is around 90 mg, for adult women 75 mg, for pregnant women 85 mg, and for breastfeeding women about 120 mg. Smokers need an extra 35 mg a day because smoking depletes vitamin C levels more quickly. Many supplements on the market contain 250 to 1000 mg in a single dose, which is far above the daily requirement. This does not necessarily mean it is harmful right away, but consistently taking high doses can cause side effects. Because vitamin C is water-soluble, the body removes extra amounts through urine. However, when people take large amounts above 2000 mg per day, they may experience nausea, diarrhea, stomach cramps, and in some cases, kidney stones. People with a history of kidney disease or kidney stones need to be especially cautious. Those who suffer from a condition called hemochromatosis, which causes excess iron buildup in the body, should also avoid high doses of vitamin C, since it increases iron absorption and can make their condition worse. Another important point is interactions with medications. Vitamin C can affect how certain drugs work. For example, it may interfere with chemotherapy treatments, blood thinners like warfarin, statins used for cholesterol, and even aluminum-based antacids. In some cases, it can also alter the results of blood sugar tests, giving inaccurate readings. That is why anyone on long-term medication should consult their doctor before adding high-dose vitamin C supplements. It is also worth mentioning that vitamin C works best when taken with food. Since it is absorbed in the small intestine through a special transport system, taking smaller doses throughout the day improves absorption compared to one large single dose. For example, taking 2 doses of 250 mg each is more effective than swallowing 1000 mg at once. The body can only absorb so much at a time, and the rest will be wasted. Instead of depending only on supplements, one should always aim to get vitamin C from natural foods. Fresh fruits and vegetables are the best sources. Citrus fruits like oranges, lemons, grapefruits, and limes are famous for their vitamin C content, but other foods such as kiwi, strawberries, papaya, bell peppers, broccoli, Brussels sprouts, tomatoes, and leafy greens are also excellent choices. By including these in your daily diet, you can often meet your vitamin C needs without needing supplements at all. Natural food sources also provide fiber, antioxidants, and other nutrients that work together with vitamin C for better health. Another myth that people often believe is that taking high doses of vitamin C will completely prevent colds and flu. While vitamin C can support the immune system, it does not make you invincible. Research shows that it may reduce the duration and severity of colds, but it cannot stop them entirely. Similarly, people sometimes think that taking very large doses of vitamin C will improve skin health dramatically or act as an anti-aging miracle, but the truth is that while it supports collagen and skin repair, the results are limited by genetics, lifestyle, and overall diet. Supplements are only a part of the picture, not a magic solution. The way vitamin C supplements are marketed also causes confusion. You may see terms like time release, buffered, liposomal, or natural. Time release supplements claim to release vitamin C slowly over time for better absorption. Buffered vitamin C is combined with minerals like calcium or magnesium to make it less acidic and gentler on the stomach. Liposomal vitamin C is enclosed in fat-like particles that may improve absorption. While these forms can be helpful, regular ascorbic acid works well for most people and is usually more affordable. If you are considering supplementation, the best approach is to first look at your diet. Ask yourself if you are eating enough fruits and vegetables daily. If not, then a moderate supplement, such as 200 to 500 milligrams per day, can help fill the gap. It is also useful in situations where your body's need for vitamin C is higher, such as during illness, after surgery, or if you are under high physical or emotional stress. Athletes, smokers, and people exposed to pollution may also benefit from slightly higher intake. Let us also talk about safety. Long-term studies suggest that moderate doses of vitamin C are safe for most people, but megadoses over several years may carry risks. There are some reports that excessive intake may increase the chance of kidney stones, especially in men. People with certain blood disorders should also avoid large amounts. Pregnant women should stay within recommended limits, because very high doses might cause problems for the baby. To summarize these points, vitamin C is essential, powerful, and beneficial, but like everything in health, balance matters. Supplements can be helpful when your diet is lacking or when your body has increased needs, but they should never replace whole foods. Too little vitamin C can cause weakness, bleeding gums, slow healing, and infections, while too much can cause digestive issues and other complications. The middle ground, where you get enough but not excessive amounts, is the healthiest choice. By now you should understand that vitamin C is not just another supplement you grab from the shelf. It is a vital nutrient with specific roles in your body, and knowing how to use it wisely makes a big difference in your health. Before you decide to start taking it, consider your diet, your medical condition, your lifestyle, and your medications. If you are unsure, consult your healthcare provider for personalized advice. Remember, natural sources of vitamin C are always the best, and supplements are just an additional tool when needed. Thank you for watching this detailed video on everything you must know before taking vitamin C supplements. If you found this information helpful, please like, share, comment, and subscribe to our channel Health vs. Natural Bites for more valuable health content. Thank you.